Welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and as always, I'm really excited that you're here. And as you can probably tell, if you're not listening to this, if you're watching this on YouTube, we are live at the ADA SmileCon, which is this is a fantastic event. And of course, I have a phenomenal guest with me today. We have Daniel Weinstein, who's the CEO and co-founder of Lura Health. Thank you so much for being here. And we're both in the ADA Foresight Innovation Hub. And I think the things that you're doing are certainly on the peak of innovation in dentistry. So just to lay the groundwork for the conversation, could you describe what you're doing at Lura?
Yeah, definitely. And, it's great to be with you too. This is the first convention that I've been to that they had a live brass band walking across the show floor. So it's definitely great energy.
Did you go in and start grooving with them?
Oh, yeah, for sure. Yeah, it's hard not to. If there's a really good New Orleans band playing right across from your booth, you can't just stand there.
Yeah,
you gotta...
that's very true. Very true.
So yeah, and we're, as you said, here with the ADA Innovation Pavilion representing Lura Health. And what we do in a quick nutshell is that we make the world's first continuous saliva monitoring platform. And get out of the jargon, what it is it's basically a tiny chip that you can wear in your mouth, either integrated into existing dental devices like retainers, guards, dentures, or as a standalone, just a bonded bracket. And once it's in the mouth, it screens for health and disease markers in saliva instead of blood, transmits out patient health information through Bluetooth to a smartphone, and then syncs up with a practice management software or electronic medical record system. So if you look at the whole landscape of health monitoring, it's a much less invasive and more accessible way for a lot of patients who already might have dental devices to seamlessly generate their health information and manage it in a more proactive way.
Yeah, that's great. And I think the impact of this is profound. And I think it would be very easy, in my opinion, to underestimate the value of having continuous salivary diagnostic monitoring. I'll put forth an example of an analogy, and then I'd like you to kind of give a similar story on how this would relate to salivary diagnostics. But I had the opportunity of meeting the head of Apple Health, and it was profound because 2 weeks previous to this meeting, was at a trade show. A friend of mine who has a congenital heart issue was mountain biking, and he wears an Apple Watch. And he got a call from his cardiologist. And he said, "What are you doing?" My friend said, "I'm mountain biking." And the cardiologist's response was, no, you're not. You're getting your ass to the hospital. That's what the cardiologist said. My friend went into
That's a good cardiologist.
Yeah, my friend went into VTAC within a few minutes of getting to the hospital. He would have died if that didn't happen. Okay, now here I am literally 2 weeks later, talking to the guy that created that technology. And so I'm, oh my God.
That story.
Absolutely.
Yeah.
How could I not,
Yeah,
right?
exactly.
And I'm like, right, you saved my friend's life, right? And he was annoyed because he hears stories like that all day, every day. Now, if you would have taken a snapshot of my friend's heart and then had him go mountain biking, he'd be dead, right? Now, maybe that's a dramatic story. However, it's true. And there are analogies when we're talking about salivary diagnostics. Would you agree?
Absolutely. I mean, where we're at now with saliva, saliva is really, the progression of salivary diagnostics is very interesting because it pretty closely mirrors the evolution of blood-based sensing. So in blood-based sensing, I think back in the 90s and early 2000s, most of it was just lab tests. Or finger prick tests. So it was all outside of the body, right? You needed to get a valuable diagnostic fluid, blood, from the body to a point outside of the body to take a test outside of the body and give the patient back that one result. But then, of course, the CGM, the continuous glucose monitors, the other implants, they came along, and instead of providing a spot check, they provide the whole movie, as you said.
Yeah, yeah.
And I think that people don't really understand that link with saliva, but it's like an exact mirror. So right now, the industry is a bunch of spot checks. So drill into a tube, send it out to a lab or test with a point of care system.
Which has a lot of value.
Yeah, for some conditions, that's all you need, right? For genetic testing, like your genome is very stable. So it makes no difference whether you take a reading now and in 3 months. And there's been some work done on A1C testing. So Colgate, Pacific Dental formed a partnership to do chairside A1C testing for diabetic sensitivity. There's some collagen testing for like tissue breakdown in the mouth. But there's a whole other subset of conditions, like the ones that continuous monitors for blood tackled, that really only have diagnostic value with the full picture in mind. So things like hormone levels for maternity health or for stress management, things like medication levels over time to track if you're in the therapeutic window and not overdosing or underdosing. Our first indicator is acid levels for gastric reflux and for dental disease, and these are always fluctuating throughout the day. So they've tried to do it with little spot checks, but it's pretty non-diagnostic because that's not the full picture. So you're absolutely right. That's kind of where a lot of healthcare is going, from this one-time metric that's kind of separate from your day-to-day that you might get in your email inbox, versus a real companion that's kind of working with you to achieve your goals.
And I'm as an interoperability nerd, right? And so I feel like once we have more data sources, we can start making correlations, causations, and start really addressing things from a overall health and oral health perspective. And you're definitely in that realm. I call it connected dentistry because we're now consolidating practices, connecting more directly with patients. But the medical dental connection and salivary diagnostics are right there in that world. And so, I got out of dental school in the year 1999. And at that time, there was a transition to digital dentistry. And there was sort of this Pong video game that was a CAD CAM system, like Serac. People were taking the paper charts and putting them on a computer. And you fast forward 25 years, and here's where we are today, where there's 3D printing and AI.
They've been taking alternate impressions, and now it's all a scan.
Now it's all scans, right? And I think you and I are both at this very entry point of connected dentistry. And so I think for the listeners and the viewers, if you're looking at where this industry is headed, I would say it's what I call dentistry 3.0 or connected dentistry. These are the themes that 20 years from now we're going to be going, holy crap, I can't believe, just like we were around, wow, an X-ray can read your X-rays can be read by an AI company, right? That's a 2.0 technology. If you fast forward to what Lura is going to be doing with salivary diagnostics, mixed in with the Apple Health information, like how does your exercise and sleeping schedule affect your salivary diagnostics and in condition A, like gastric? I'm just sort of the top of the mind thoughts that I'm thinking, right? That you're going to be making predictions and treatment plans in totally new ways, right?
Yeah, absolutely. But I think what's important is that, and what a lot of people kind of get wrong about the technology evolution within dentistry, is that they think that it's just inevitable, right? But in most industries, that's not the case. It really takes that entrepreneur or visionary in any sector that can match the technological value with existing needs of the population. So if there's a great technology, but there's no way to deliver it, to adopt it, there's no additional value, there's no additional payment structures, it's not going to benefit patients, right? And that's true on the physical side, because we produce hardware, but it's also true on the software side, right? Because it doesn't happen automatically. And a lot of times you can have first movers who carve out a lot of the field with a first approach, but aren't really adapted to evolve continuously over time as technology keeps pace.
Yeah.
And that's one of the things that I really am inspired by what you're doing is there needs to be a delivery mechanism of that data that's compatible and can plug into the ecosystem where it's actually needed instead of where somebody's saying it should be, you know?
Well, and then like, and then doing what you're doing with like the specific use cases that we can fundamentally elevate care, right? That you're doing, it's phenomenal. So today, if the dentist is thinking, I'd like to incorporate continuous salivary diagnostics into my care,
Yeah.
what would you tell them?
Well, I always start with a question. I say, how do you get your dental devices today? Do you work with a distributor? And then they'll say, most likely, yeah. And I ask, okay, well, Shine, Patterson, Banco, like, where are you using to get working with an independent lab? And then if they say, oh, yeah, we're working with X distributor and we, our front office just orders from them on their industry catalog, I tell them, engage with us now, but keep your eye out for that catalog because our model is to work directly with the large dental manufacturing companies to upstream integrate our sensors into their products and so that they can deliver now smart devices. So they already have the distribution channel, already have the marketing, already have the sales. And for a dentist, it'll just be as simple as looking at the new SKU next to the regular retainer or regular aligner and ordering the smart aligner that can monitor patient's health and together create a more effective treatment plan for that individual patient.
Oh, that's great. And so where can people go to find more information about Lura Health?
LuraHealth.com and follow us on LinkedIn. We're doing the conference circuit as you are. So
we're here right
exciting
now.
events. So definitely follow us and drop a mention.
Great. Well, thanks. Thank you very much for being on the pod. And I look forward to watching you and Lura just and all the cool things that you're going to be doing. So appreciate you being here.
Thanks, Brian. Appreciate you too.